I am 20 and my hair fall is continuous for 2 years. What should I do? Now, my hairs are very critical. They fall off while combing, taking a shower, or taking hands to my hair. My father is also bald, but I don't want to be bald.
Thank you for your question. You're 20 years old and you state that your hair has been falling out for the past 2 years. And there's a family history of baldness where you say your father is bald, and you're stating that, of course, you don't want to be bald. Well, I can certainly give you some guidance, although there's no photo that you provided, but your history probably is adequate for what is statistically likely the situation. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize in hair loss treatment. In fact, I'm the founder of TrichoStem Hair Regeneration Centers, a technology we developed for non-surgical treatment of male and female pattern hair loss. So, based on your history, there are certainly no other indication other than it's most likely what you have is male pattern genetic hair loss. And it's not unusual. We have seen many people who started losing hair by the time they were 17, 18 years old, or even younger, and would be completely bald by the time they were 22. So we've had many patients like yourself, and as more and more people have learned about the technology we developed called hair regeneration, which I'll discuss further, we are seeing people younger. And the challenge is the genetics. What essentially you're experiencing is this rapid progression of shortening of the hair growth cycle. And many of those hairs are at their terminal growth cycle. So even after they shed, if they don't regrow, they're just never going to grow because the hair follicle is no longer viable. The challenge with the young person is that you're not really a good candidate for a hair transplant because you just don't have enough hair from your donor area in order to transplant. In addition, there is variable response to the medical treatments. I don't think in your situation minoxidil will make that much of a difference. And finasteride, which is a drug that you take daily, as of late people are becoming more and more cautious about choosing to take finasteride. This is a drug that you take by mouth that inhibits an enzyme called 5-alpha reductase. And this is an enzyme which causes the conversion of testosterone to dihydrotestosterone, commonly referred to as DHT. DHT-sensitive hair follicles will actually thin and eventually stop growing. If you block that enzyme, you can slow down that progression. Unfortunately, only 60% of men respond, and that certainly is not the best odds. And a lot of people are choosing not to take this drug because of concerns of sexual side effects. In our practice, we treat people like yourself with something called hair regeneration. Hair regeneration we developed out of the technology we were using to help people with hair transplant have better outcomes in terms of the graft survival. A side effect was that thinning hair became thicker. I eventually developed a protocol and process to use for as a non-surgical solution to help people with thinning hair. So even on people like yourself who have very strong family history, who have aggressive hair loss, I've been able to accomplish the following with hair regeneration. We're able to stop progression, we're able to reactivate hairs that are not growing, and we're able to induce thinning hairs to shed and thicker hairs to grow in. Now, unfortunately, this is not a perfect solution in a couple of ways. First of all, 99% of both men and women respond favorably. However, the limitation is you have to have hair follicles. So the earlier we catch someone, the better it is. That being said, I think that for someone like yourself who would come to our practice my first recommendation would be to do hair regeneration. I'm not dissuading you from using finasteride or minoxidil, but I think that even with people who take finasteride, there is a certain significant decrease in compliance by the second year of taking finasteride. So I think that for us and for patients who come to us from all over the world, and we're extremely busy helping people with hair regeneration, we've had very, very good results. And so for someone like yourself who wants to do everything possible to avoid baldness, I think it's worth learning about this option and finding a practitioner near you who can offer this. So I hope that was helpful. I wish you the best of luck, and thank you for your question.